Hello, everyone. Welcome back to SPIA Speaks. Today's podcast is going to be with Dr. Leo Rouse. Dr. Leo Rouse is such an excellent leader and has so many accolades. First and foremost, he is now the current ACD President. He has been the Colonel and Chief Operation Officer of the Army, the Dean of Howard University, and also the ADEA President. And not only was he in the highest position in all of those, but he also changed so much. Dr. Rouse has been influential in the change of dentistry as we see it today. And in this episode, we talk a lot about interprofessional education and how important it is to involve other specialties, such as doctors, therapists, social workers, nutritionists, all kinds of people in the healthcare field to make the patient's health the number one priority and really, truly comprehensive. So please enjoy this episode. Kind of rush you, but
I'm ready to go. Yeah, we're ready to go. You just go ahead and do your thing now, okay?
Cool.
We're ready to go. Thank you.
Cool. So I'd like to start off with talking about some of the stuff that you've accomplished in your life. I mean, you have had an incredible life story. Just reading some of the CVs that I've read and any article that's been written about you. I mean, you have done a tremendous amount for the world of dentistry, and so I really want to kind of start with that.
Okay.
Mainly starting with, we can go back to your dental education. I know you went to Howard and then you were the president later on, but we can kind of start with the dental education. How was the experience of going to dental school, getting into dental school? Just even, how did you become a dentist, really?
So it's a great story, okay? I like to go back to when I was in the third grade in New Jersey, where I was introduced to dentistry through my family dentist, who was also a Howard University alum. And I always tell folks, if you want to pipeline young people, you have to start them early. And you got to let them know that if that's your vision, that's your dream, pursue it. You know, let anyone ever say to you, you cannot do that. You're not qualified. You're not ready for it. So I've known since the third grade at public school number 22 in New Jersey that I wanted to be a dentist. And that's how I got started. And when I tell students, alum, or anyone who's in a conversation with me, so that's how it began. So I'm big on pipeline programs, regardless of your ethnicity, your gender, whatever. It's about young men and women to follow their dreams. So I had a great dentist who really encouraged me to pursue it. And how I got started, I was back in his lab playing around with some wax. And he said, "Oh, you have pretty cool dexterity." And I remember when I took, and you didn't go through this, but back in the day, we had to carve a piece of chalk to get into dental school.
In your right?
That was part of the application process.
Yeah.
And so you learn how to whittle, how to follow the measurements, et cetera. And after cracking many pieces of chalk, you finally get it down to a science. So dexterity is critical to being a dentist. But more importantly, it's about the ability to really follow your passion and your dream. I got Howard as an undergrad, and I knew the dean, and I knew some of the faculty members, and so off we went. It was a good experience. One thing that I always tell students, even when I was a dean for 12 years, 13 years. One thing I tell students, when you're in the basic sciences and you're part of the medical school, you may not think all the ologies are not important, plus anatomy, but physiology, microbiology, pharmacology, anatomy, biochemistry, those are very important subjects. And you don't think about it then because in your mind, I want to be a dentist. I'm not in medical school, I want to be a dentist. And so, but when you realize how you interact and how you integrate those subjects into your clinical world and dental education, it is really important. And so I was reminded of myself when I was a young freshman. Yeah, I don't care about that stuff. I'll go and get those courses done. And I love carpentry, anatomy on the cadavers, blah, blah, blah. Love going to the micro lab and playing around. That's cool. But it's important today. And as you are a mentor and your colleagues who are listening to this particular podcast, it's about letting young people know the value of following your dream. And there are a lot of people, regardless of your ethnicity, who are told, you're not good enough to be a dentist. You're not good enough to be a physician. You're not going to be an architect. You're not going to be a teacher. and they want to direct you into other areas where they feel you have more ability. Well, I found it to be the case in a lot of young men and women who have come to dental school, and they'll say, after the first semester, I have some difficulty getting through that anatomy course, the biochemistry course, pharmacology was kind of tough. I said, hang in there. You're going to do fine. So it's about how you nurture. I'm a people person, Rebecca. I have tremendous confidence in young men and women, and that's important. And I think a majority of the deans and faculty feel the same way. So that's my story in that regard.
That was excellent. I think that a couple of points that you talked about that I think are really important is, one, understanding how much the basic sciences really do play a part in our profession. I mean, just in clinical setting, which I'm not even a dentist yet, I'm still in school, obviously, and you see things, medication interactions, or why did a patient will ask you, hey, why does this happen? And I mean, mainly it comes down to, well, in your cells, you can kind of defer that into something you learned even in college, like as a Bio 101 major. And so being able to educate your patients on so many different levels of education, I think is really important. I also liked how you discussed that you may have a bad course, you may have a bad trimester, something may really beat you down, and you're like, I don't know if I should be here. I don't know if I'm supposed to be where I am. And people told me my whole life, like, oh, you're not good enough. And so then you have that moment of, well, maybe I'm not. But like you said, it always works out, and you have to have faith in yourself, and people around you obviously trust in you. That's why you are where you are. So those were really great answers.
2 points to add to your comment: confidence and humility. You will learn humility in dental school. There are things that you think you may know. And I can tell you honestly, I've had many men and women come to my school when I was dean who had master's degrees in biochemistry and microbiology, who fell flat on their face because their attitude was not tuned into what was presented to them. And I will always tell the students, regardless of what your discipline is, whether you have an MPH, MBA, PhD, let me tell you something, you're going to be challenged. And the challenge comes because in most cases, you have faculty members who are a little older than you are. Some may be boomers, and they tend not to want to listen to your complaints or what you think you may know. Mm-hmm. And you're right about patience. Patience are the trigger here. You'd be surprised, as you know from your USC experience, patients know a lot more about us than we think we know about the discipline. We can Google stuff now. We can Bing stuff, okay? And they can tell you, well, I know about what that class 2 means. I know what that implant means. And they're going to challenge you. So that's why the integration of basic science and clinical dentistry are so critical. Plus, let me also add, we're going to discuss IPE later, but I'm big on IPE. And the critical thing there is the reality of how do you really talk to your patients about their total health or their overall health when you're trying to define and work with their oral health. But there's an integration there. We'll get back to that a little later.
Yeah, absolutely. Well, and another point with confidence that you made is, I mean, everyone in dental school was top of their class at one point. They were always the best of the best. And now you come into a field where everyone was the best of the best. And how do you deal with that? I had a hard time. I know when the person sitting next to me in sim lab could draw, when we were drawing teeth, could draw a tooth like nobody's business, and mine looks like a stick figure. And I had a hard time with not being the best at something and being able to be humble about, okay, it's a learning process and it's okay, you'll get to where you're supposed to be eventually. So
that's a good point, Rebecca. I used to tell the students during the orientation, we'd be in my conference room, very long table, and I said, this table is flat. Think about it. All of you are coming to this institution from great schools. I had kids from Ivy League schools. I had kids from the West Point. I had kids from Air Force Academy. Good schools. I said, you're all on the same sheet of music, regardless of what you think your GPA may have been in science and total. You're all starting together on the same plane.
Yep,
and it's competitive, but you got to develop relationships with your cohort. And that's the key thing.
Okay, so you go to Howard, you go to Howard and you're done with your education there. And then you decide, God, I want to go into the military. So what brought you to that decision, and how, I mean, you advanced colonel and chief of operations. I mean, excellent positioning in the military, but how did you even choose to do that route, or what drove you to that now?
Well, what really drove me to that was my dad.
Yeah.
My dad fought in World War II. He was in the Navy. My dad, during that time in the 40s, African-American male, was a cook, okay? And when I was in college, he used to tell me, I need for you to really look at ROTC. And ROTC at Howard during that time, my first 2 years, was required. The advanced course you applied for, okay, to go to officership, but you had to do ROTC at Howard, Air Force or Army. I chose the Army. And it was time to make the decision to go into the advanced program, where you're now in a commissioning program. I chose to do that. My dad was very, very proud of me. He wanted me to be an officer, whether it was 2 years or a whole career. So that was my route. I was an ROTC, got commissioned the same day I got my bachelor's science degree at Howard, and I was a second lieutenant going to dental school. So I was already an officer in the Reserve Corps as a medical service corps officer. And I knew I had some great mentors. So again, it's another discussion about mentorship, whether you are being mentored to go into ortho, whether you're being mentored to go into the military, go into public health corps, go into the VA system, but just go into private practice. That was critical to me. So my dad was my influence to become an Army officer. And then I had other individuals while I was in dental school who were retired Army dentists who also played a role. In fact, one of my mentors at the time, he's deceased, but he was a Tuskegee Airman. So think about how far back that goes.
Yeah.
Okay.
Yeah.
And his name was Dr. Victor Hancock. Okay. And I can tell you, Dr. Hancock in endodontics was one of my mentors who influenced me to move forward towards a military career.
And do you think that, I mean, looking back, maybe some hindsight, are you glad that you went the military route for so long? Or, because I know some students who are going into the military after dental school are now that we're in our third year are thinking, whoa, I kind of want to do some private practice. And we have this conversation a lot where, you know, everything works out how it's supposed to, but there's so many good opportunities in whatever branch of the military you choose.
Yeah.
For dentistry. I mean, you will learn so much. I mean, you learn a lot in private practice also, but the vast amount of dental work that's going to come to you. I mean, you have children, you have adults, you have people who came back from war who haven't maybe done anything on their dental care. And I mean, I just feel like you're going to see a lot in the military world. Do you agree with that, or do you think that private practice is different?
It's a personal decision, Rebecca. I was fortunate to have mentors while in dental school. I was a health professional scholarship recipient. So I spent time at Walter Reed during my last couple of years in dental school. So I was exposed to officers who were board certified dentists who had gone through military training program, postdoc training, who basically were influencers. They were mentors. And Dr. Bernard Whitsey, God bless his soul, he passed away last year. But Dr. Whitsey and his wife brought me and my wife into their home. And I was concerned, what am I going to do? I said that I got to pay back these 2 years from my ROTC experience.
Right.
He says, this post-Vietnam, 1975, Vietnam is winding down. He says, you go into private practice in New Jersey. I can tell you right now, the economy is going upside down. It's tanked. Consider the military as initially a career. So I said, okay, I'm going to go hang out for a few years in the Army. Little did I know, my wife, at the time I had a son, they both enjoyed it, and off we went. And so those 28 years, Rebecca, were like, they went by so fast, but criminy sakes, I had a blast.
Yeah.
I lived the world. I experienced other cultures around the world. And so, you know, the rest is history, but it's about your individual decision. You guys today have many options. You're in the COVID-19 world right now. the pandemic kind of put us in sort of this, I don't want to call it, it's sort of like a paradigm change. DSOs are becoming more out there. The Public Health Service Corps are seeing more young men and women out of dental school who are applying for the Public Health Commission Corps. Admiral Tim Ricks, who is a good friend of mine, he's the Chief Dental Officer for the U.S. Public Health Service. Tim is a super guy, and he's been very active on your behalf and my behalf during the last 13 months with CDC, dealing with the ability, I got to tell you, what you're experiencing now in your cohorts in all the schools around the country, literally, the pandemic has helped address issues. Yeah. Dentists are now able to do vaccinations, can do A1Cs. We should have been doing testing way back a year ago last March, all right? So that has been a positive thing. And Tim has been kind of like the guy behind the scenes at CDC in Atlanta, raising Cain to make sure we did that. But I also give the state legislative bodies also a big plus, because California, your governor, they saw this as an opportunity. All hands on deck is an all military term, where you learn how to give anesthesia when you're in your first semester, your second year. You were going through that process. You took the local anesthesia course. Who best to put an injection in someone's arm? Who best to do a prick of the finger than dentists? Yeah. Okay. And you're there. Yeah. Exactly. So that's a blessing of COVID-19. I think even the issue, Rebecca, with licensure. I know out in California, you guys are involved with portfolio and OSCE and everything else. I've been there. I was on a licensure task force. So I understand all that. We've been fighting for portability, freedom of movement, eliminating patients. I've been at this now since 1973. All right. That's almost 48 years, Rebecca, fighting for. I had 5 licenses when I got out of dental school. I'm going, what is this? Texas, New Jersey, Maryland, DC, Massachusetts. Like, give me a break. It's more important today that we do things, I think, that make sense. I think state boards, I respect them now, what they're trying to do in our profession. So you are a recipient of a lot of changes, and your colleagues on this podcast, of what we've been fighting for many, many years, okay? And here comes a pandemic, here comes COVID-19, bingo, we're doctors also. I was asked a question by a student at UNLV last month. Well, Dr. Rouse, give me a break. People think that we're technicians. I said, no, it's how you conduct yourself professionally. Whether you have a DMD or a DDS degree, you're a doctor. And so now we are essential, Rebecca. We are essential, okay? In the military, I learned how to do alternative wartime skills. You don't do class 2s on the battlefield, Rebecca. You're dealing with sucking chest wounds, broken jaws, busted jaws, missiles or IEDs that hit someone, whether you were in Desert Storm, whether you were in Afghanistan, whether you were in the Iranian conflict, you learn how to triage. And literally, those skill sets are still with me today. But I can tell you, I would make it very clear, I used to tell people laugh. I said, I'll make you laugh. You think we got time to do class 2 in the middle of getting bombed up? No.
Yeah. We're like, hey, I know your face hurts, but you got a cavity here. Let me take care of that for you. Absolutely. Yeah. Finding the important. Well, and such a great point that, people have been fighting for years for just the ethical way of performing dentistry. Like you said, why can we not take the HbA1c? We know how to prick a finger. We know how to use a needle. And it's vital for us to know what that number is before we start procedures. There's no reason that we should have to wait for an MD to tell us that when we can take it just as easily at our office.
Well, as part of my CV, I served on the expert panel for IPE back in 2008-9 timeframe. And I worked with nurse practitioners, osteopathic, allopathic physicians, public health individuals, people who were involved in social work. And it was all about how do we tie in. I tend to leap forward sometimes, Rebecca, so slow me down.
Okay.
But it's all about how we tie in. My military experience has helped me understand more about the integration of primary care and oral health care, period. And when Dr. Valakovic, who was at the time the president and CEO of ADEA, asked me with Dr. Sandra Andrew, who was a PhD hygienist, you're going to represent ADEA on this task force to look at the competencies for interprofessional education, which we did. And it was always a challenge to get people to realize, yeah, we are dentists, but we're also doctors. We have DMDs or DDSs. And the challenge is, well, who's going to be in charge? It's always the physician saying, we got to be in charge. We had a nurse practitioner who literally chaired that committee, and we moved forward to work on the competencies. So back to dental school again, in my experience as a dean, I wish now that I had actually integrated social workers into my dental school, occupational therapists, physical therapists, pharmacologists who had the ability to do clinical pharm, to put them on the clinic floor with the students. And some schools are doing that now. I know on the West Coast, some schools have involved OT and PT in their curriculum. Detroit Mercy has social workers and psychologists in their school with nurse practitioners. I brought social workers into Howard, even back when I was a younger dean, just to talk about behavioral activities amongst our faculty, staff, and students and patients. So it's an all hands on deck. It's healthcare at its best, healthcare education. Okay, it's critical.
Well, we can roll into IPE. I think that's totally fine. For those of you who don't know, IPE is interprofessional education. And so really evolving the comprehensive care into actual comprehensive care. We're not just doing comprehensive dental care, but comprehensive primary care, whether that's involving, as you've just mentioned, MDs, OTs, physical therapists, whatever that, nurses, psychologists, social workers, whatever that looks like, because ultimately we're in charge of the health of the patient, whatever.
Exactly.
It doesn't matter if it's just in the oral cavity. And as I kind of emailed back and forth with you, dentists are such a primary caregiver that more people go and see their dentist every 6 months than they go and get a physical by their physician. So how is our job not more active in their primary care? I mean, we take their blood pressure, we can see their A1C, we can talk to them about diet, mental health. I mean, when they're sitting in the chair and they're nervous, we can talk to them about anxiety or things that have happened in their life that, someone maybe passed away or they've had a hard divorce and now their oral health care has gone down. And that's just one sign of healthcare that's gone down. You can imagine mentally where they're at, physically where they're at. They're probably not exercising regularly. And so now we're seeing deterioration of the body as a whole, not just the mouth. And it starts at the mouth. That's where we can see it. But I'm 100% on board for IPE. I think that however we can help the patient best is what we need to focus on. It doesn't matter if they have the class 2, like you said, if their anxiety in day-to-day life is through the roof, it doesn't matter. They're never going to take care of their oral care until you can address their mental health.
One of the first things you probably learned when you went into the clinics, we don't look at teeth first, we look at teeth last. We do a full medical history to go along with our oral health history, okay? And why is that done? We want to get a full understanding. It's just not from here up, head, chin up to the top of your head. One of the coolest schools in your state is Western University. And I love USC. I know your dean very well, Afashai. But let me tell you, I went out to do the graduation at Western University down in Pomona, California. Mm-hmm. It was a combined graduation of the pharmacy school and the dental school.
Wow.
And that school has 9 health science schools that are lockstepped, totally integrated. Okay. Yeah. So when osteopathic medical schools were beginning to move forward their medical school versus an allopathic medical school, they knew they had to bring in an oral health component, i.e. the dental school. All right. So where was that happening? It was happening at AT Still. It was happening at LECOM in Florida. It was happening at New England up in Maine. Osteopathic schools realized, hey, we got to bring in a dental school. And you probably don't notice, you may notice, but there's a new dental school. It's going to be called Liberty Memorial University in Knoxville, Tennessee. It has osteopathic medical. It's going to be our newest dental school.
Wow, very cool.
Okay.
Go ahead. I'm sorry.
Linda Neeson, who's a dean now at Kansas City University, is going to have a grade school. But when Linda was dean at Nova, Dean Neeson, she brought in DDS and OD degrees. So it's just like Jack Dillenberg, when he founded AT Still out in Arizona, Jack brought in the MBA, the MPH component for his dental school. So when you get a dean who thinks out of the box, you may not know this, but Dean Mike Alfano, Dean Emeritus of NYU, and Dr. Judith Haber, Dean of Nursing School, combined the dental and nursing school years ago. All right. So the models that are out there, they work. I'm not sure if you know Wendy Malvanian, who is a pediatrician, University of Washington Medical School. Well, she's integrated pediatrics, oral health care, pediatrics, pediatric dentistry. Do we have people who are MDs? If you've been following the Harvard School of Dental Medicine models, the integration of primary care and oral health care, all these models are about the fact that healthcare has to be integrated. We may be the mouth champions, and I use this in a lot of my lectures. Don't get excited when I say this, Rebecca. Dentists do not own oral health. We own dentistry. That's our profession. When I make that comment, oh, here we go with Rouse again. Here we go. Here's the point. Who are championing oral health today of all the healthcare providers beyond what you and I do every day? Nurse practitioners. Mm-hmm. Okay? And so we can't be afraid. There are dentists who are my age, I'm in my 74th year, who are boomers, who think, we got to protect the profession. This is our profession. You know what? When you get letters as a clinician at USC from a patient that you may have referred to his cardiologist or internist or family practitioner because you noted his blood pressure was like 150 over 120. And he goes to see his physician almost in stroke city. That reflects back on you and your experience in managing from a systemic point of view his healthcare, because you're concerned about his health before you do maybe that periodontal scaling or that implant or that class 2. Okay. And so the message to all of your listeners on this podcast, understand you are a doctor of dental medicine or a doctor of dental surgery first, and the doctor is what drives the train here. And so you have to understand what we've been doing for the last 48 years plus, trying to get everybody to realize dentists are essential. Give me a break.
Oh, yeah.
Whether you're an orthodontist or a prosthodontist or a periodontist, you have a responsibility to that patient. And you said it earlier. Who do we see? Who do they see initially? Dentists are important cogwheel. Patient in the dental chair. Just imagine you're in the dental chair. Okay. You just gave him a mandibular block to do something on maybe number 29. The same time, you go, here's your vaccine for COVID-19. Oh, by the way, give me your finger. Boop, doing the A1C. We do the quick test. Oh my God. Boop. Your A1C is above 8. Duh, we have a problem here. Earth calling problem. Okay. It's a referral. And the patient will appreciate it because they don't go to see the physician as they do to see the dentist. And so those are the challenges. So that's why I am so big on interprofessional education and collaborative practice. I'm big on tying in. When I hear physicians talk about oral health, I go, cha-ching, cha-ching.
And I have a great example of that. We were in oral surgery rotation, and there was a student in there, and Dr. Tung is our oral surgeon at our school. And she was saying that, a student got a referral and said, something looks kind of funny. There's like a bony mass in the mouth, and I don't know what it is. This is the MD. And so he referred it to the school. Patient was a patient of the school. And the dental student laughed and was like, what an idiot. It's just tori. How would he even know? And Dr. Tung said, no. We don't bash anyone, because the fact that he even had the patient open their mouth to look, can you believe that? They don't ever look in the mouth. And for them to think this might be something wrong and I want to refer it to someone who really knows. I mean, that's excellent. It's just like us when we see something and we're like, I'm not really sure, go look. Can you imagine if they made fun of us every time? It's neat when they do something that's out of the ordinary, that should really be normal, that they should be looking and being able to say, I'm not sure what this is, please go see someone. And then I want to give an example of this. So just last week, I was on the clinic floor and the patient's medical history is out of date and we need to bring it up. And so the patient sits down, he came in pain. And I start looking over the piece of paper and I'm asking him, oh, so I see here you have high blood pressure and okay, you take lisinopril to manage that. Okay, that looks good. And we're going through and he stops me in the middle of it and he goes, when are you going to open my mouth? I said, well, I'd like to look at everything first because I need to know about you before I can treat anything, because I don't know anything about you really. And I would like to make sure that I'm doing a comprehensive treatment on you. And so we're sitting there kind of talking and he goes, oh, okay, I understand. And we get to it and it's at night clinic and he starts kind of, I'm like, you got a dry cough? He's like, yeah, it's been coming on for like 2 years. So when did you start taking your medicine? He's like, about 2 years ago. I'm like, maybe you should talk to your physician about changing your ACE inhibitor and getting medication for your blood pressure. And he goes, really? You think that that's what it's from? I said, I don't know, but it'd definitely be worth having a conversation. And he said to me, wow, I'm glad that you looked over everything, because how would you have known that otherwise? Or I would have just kept going on with my life without even thinking about it. And so it was a situation like that where I realized firsthand that it is so important to look at everything about a patient, not just what's going on in your mouth. And even if he was coughing and I didn't catch it, later on I could have thought about, it's just, he was so grateful that there was a way to get rid of that cough, because he was saying how much it had been bothering him for years.
Right. Exactly.
So it's just neat that if you really do understand your basic biology and things that we learned in that first and second year of dental school or undergrad, I mean, you could really put that stuff into implement it into your daily care and be able to actually help a patient get better, change their lifestyle.
Rebecca, it's good you tell that story, and it's good that your listeners are hearing that also, because they have stories also. One of the things that I like to stress to our dental students and even our residents, our postdoc programs, it's very simple to overlook something because you're in a hurry to get what you might think is your last competency to get this partial denture done, okay? The reality is that patient at that moment belongs to you. You're responsible for that patient. And all you need to know is that you listen. Listening is important in this business. But in the whole integrated healthcare system, the value of listening, I can give you a good example again, as you talked about earlier. I'm at Weston, I'm in their primary care health facility. I'm in the podiatry clinic, listening to a P3, third year podiatry student, talking about a patient's foot and ankle ulcers. And I'm standing in the back with Dean Friedrichsen, the Dean at Weston, and the P3 says to the patient, I'm through with your exam. I want you to do the following things, but before you leave the building, go up to the next floor and talk to the dental facility about your bleeding gums and your poor oral health. Talking about and I said, cha-ching, and he looked like he said, who is that? And Steve said, that's Leo Rouse, who, by the way, was also deputy provost for health affairs at Howard. And he said, he's just excited about the fact that you even said, go to the dental clinic to get your gums checked out. Okay. Yeah. Well, that's critical. It's critical. We talk about primary care. Dentists are going to make money, Rebecca, regardless of where you are, whether you're in private practice, DS, or whatever. The important point is use your skills as a doctor to help your patient get through. We think about the early 80s when HIV/AIDS was really discovered in San Francisco, but you might both know you can actually see a patient today and determine that they have periodontitis. Okay, And you know, with a good scaling and route planning, you can get through another week, floss, brush, rinse, blah, blah, blah. And hopefully the inflammation will be gone in a week. It takes 7 days for that thing to happen. You can scratch your wrist or your finger, your arm, and that's going to heal in about a week. If it doesn't, there's an immune system problem here. So I'm big on immunology. I'm also big on genetics. You're going to ortho. Let me tell you something. Understand the value of genetics and what it means, and how you understand the sequence of genomics as some child is developing his mandible and maxilla. These little teeth are beginning to kind of show up, and you're trying to decide mixed dentition, what am I going to do next? How do I do this? Growth and development is tied to genetics, as you well know. So we're going into a science discussion, but it's all about discussion about me. But I can go on and on about this stuff forever.
Well, and what was really cool that you talked about with Western that I had never heard of is that they're in the same building, that you can go up to the next floor and that's where dentistry is. I mean, we talk about having the referrals. Oh, it's so nice. You can go downstairs and go to see OS, and then you can come back up to the second floor where we'll do your denture try-in. And I think that that's neat that we have all those specialties there. But imagine growing your referral list to, wow, your shoulder's been causing you pain and you sitting in this dental chair isn't the best on your neck maybe, or your shoulder. I've got a good physical therapist that can help you out. Like having that.
When you get a chance, you need to go down and visit Western. I was so impressed. 9 health sciences schools, including veterinary medicine, sitting in seminar rooms, D1s, D2s, D3s, case seminars, being challenged. University of Minneapolis, University of Minnesota, similar scenario. I was on what is called the Nexus, but I was on that board where we talked about IP. Barbara Brand, Dr. Barbara Brand, who was a PhD pharmacologist, sharp young lady. Well, I'm going to tell you, when you look at students, when they take themselves as a cohort with their medical, nursing, pharmacists, social work, their colleagues, and they have conversations, I'm very pleased to see their future, as you will see as you get out there, how they literally work as a healthcare team. I had the responsibility to talk to health science librarians when I was at ADEA as a senior scholar. I went to their meeting. They were the 21st group to join the IPEC, the Interprofessional Education Collaborative, IPEC. Let me tell you something. I made it clear. I said, who else can make this work other than librarians? You see every student in the health science family as a librarian. And if I could convince you to be part of this team, oh my God, think about it. You are going to really help the next generation of healthcare providers literally understand how to be a good team. And they're part of the IPEC.
As they should be. You are absolutely right. I wouldn't have ever thought how vital they are in that role.
Oh, yes.
They do. They see every type of student, and
that's exactly right.
God's gift to the world, because they have so much knowledge about everything. I mean, you can ask them anything and they really know.
They know.
Excellent point. I never even thought about integrating the librarian.
A lot of fun.
Yeah. I've never even heard of IPEC. You would think
look, when you get a chance, Google IPEC,
okay,
Interprofessional Education Collaborative. Okay. That's where all the health science association, all the health science educators are lockstep.
Okay.
They are lockstep. And they train together. They have seminars, they do webinars, okay? And the value of that, when I was talking to social workers, you'd be surprised. You may go into an assisted living community. You may go into a nursing home. You may have home caregivers who don't understand what happens when a denture is ill-fitting, Rebecca. As you well know, the things that can happen, the nutritional component, to have nutritionists involved in the discussion. I remember meeting Michelle Obama, and I did at basically I went to a meeting and I was invited as Adina Howard because she was into this health thing about nutrition.
Absolutely.
And I had to make sure she knew the effect of having vending machines that dispense candy and soda in the schools.
Mm-hmm.
And she said, "What is your role, sir?" I said, "Well, I'm the dean at Howard. I have a pediatric dentistry residency program. I have orthodontics program. I have GPR. I have AGD. I got all this stuff." I said, "I'm worried about the kids." She says, "I didn't think about the fact that they can go and chew on some candy during their little lunch period or during their little breaks and create carious lesions."
Mm-hmm. And
I
then
talked about
yeah.
I talked about Diamante Driver. Do you know the Diamante Driver story?
I don't know.
I'm going to give it to you for your listeners.
Good.
Diamante Driver was a special needs student who lived in Maryland. February 27th, 2007. This is a young kid that went to special needs student, went to a clinician in Maryland with a acute dental need. He had basically an abscessed tooth secondary to a carious lesion. Was not treated because the fact that he didn't have Medicaid. He was Medicaid ineligible, his whole family. I'll make a long story short, fast forward. This young man literally had an abscessed tooth that became a brain abscess, and he died at the National Children's Medical Center in Washington, D.C. When you get a chance, look it up, Diamante Driver, all right? This really got the CHIP program, the Children's Health Improvement Program. And during that time, George Bush was president. Good buddy, I know his wife very well, came to visit Howard when we were doing a lot of work with HIV/AIDS. And I gotta tell you, Rebecca, people who are politicians, when you talk with them and they see and they experience things, they say, "Oh my God, we had a kid die from a toothache?" I said, "Not the first kid, nor will be the last kid." All right. I said, "You understand the value of having access to care." All right. And I know his mom, Mrs. Driver, very nice lady. We have a clinic at Howard that we named the Diamante Driver Clinic, our PEDS clinic. And we then sent our residents over to Maryland to be a part of the Cheverly Health System to ensure that kids had access to get good examinations, especially special needs kids. It's a true story. And, these are stories that stick with you, that help you understand the value. Have you read the 2000 Oral Health in America by Dr. David Satcher, former Surgeon General?
I have not, no.
When you get a chance, Google that, and also advise your kids on this, all our colleagues, not kids, on this podcast, to Google the 2000 Oral Health in America. David Satcher, former Surgeon General, he's a physician, okay? And understand what he was talking about way back in 2000, 7 years before Diamante Driver died, that dental caries is the most significant child disease above asthma. And David Satcher was talking then about the integration of total health and oral health. A lot of this history is important to know because it gives you a foundation as to how we move the aspect forward in total health care for all. Health inequality, as you well know, that's another story. I can talk about the inadequacies, about inequities in healthcare, whether you're minority, whether you're female, whether you're LGBTQ. What happens when you don't have a good focus, what we call DEI, diversity, equity, and inclusivity in healthcare delivery? It's a whole nother discussion, Rebecca. And you at USC in California and all your colleagues, I really respect the schools. I know all the deans that are in California. And I know the challenge they face with trying to do, I use the first, if you read any about my stuff, when I got the ADA Distinguished Service Award, I use the phrase, do the right thing right always when you can the first time. And know your history. That's important. And study the issue of health inequalities, health inequities, access to care. It doesn't really matter whether you're Native American, with African American, Hispanic American, white American. It doesn't really matter. It doesn't matter. We are doctors. We are charged with the responsibility to take care of human beings. We don't see color. We don't see gender. We don't see someone's personal issues related to what they may choose to do with their life. Our whole LGBTQ community is critical to what we do in healthcare. You understand the issues that the individual who now is the number 2 person in Health and Human Services is transgender from Pennsylvania. Okay? And what's wrong with that? But there are folks who don't see the big picture. I'm a big picture guy. Think out of the box. Read, understand, learn. One of the biggest things to do when it comes to racism, Rebecca, is to travel. Travel allows you asked me a question about my military experience. I lived all over the world. I had a command that was 4,000 people worldwide. Opportunity to go into the Middle East. I spent time in Germany. I spent time in Far East. I spent time in Asia. I went to China, Singapore, Thailand. It gives you a view on cultures. I went to South Korea in 1993. Everybody had on a mask. Well, what the hell is going on here? Why are they wearing these masks? They are disciplined. This is why they're doing so well, the South Korean and the Japanese are doing well when it comes to, even though they claim everything began in Wuhan, China. I've never been to Wuhan, I've been to Beijing. But I can tell you, the Asian culture, you have to understand it. The European culture, the Persian culture, you have to understand it. And when you do that, you realize we're all different. But you know what? You look at the World Health Organization, you look at oral health, they get it. They get it. Japanese get caries. Nigerians get caries. People in UAE, United Arab Emirates, they get caries. Okay. It's what we do as a profession. And we learn how to use the global sphere to help improve oral health for all.
That was excellent. God, that was your TED Talk right there, Dr. Rouse.
Well, one of the things that I'm doing, I'm writing a book. In fact, I was just going to tell you, you'll see it. If you don't see it, make sure I get it to you. We have what's called the ACD, American College of Dentists, newsletter. And I know you're writing something for Suzanne, okay?
Yeah.
And so when you see the President's Forum, which I just completed, I have a topic and it's entitled Mother Wit. Mother Wit is a Southern term, the common sense of leadership for the American college into the 21st century. I believe in brevity, but it's a pretty cool article. It's going to really inspire you, I hope. I say some things in there that are critical to what I feel American college needs to be doing in terms of advancing excellence, ethics, leadership, and professionalism. Okay? I believe in that. I tell people all the time, they say, well, where do you get all this stuff from? Everything I've learned about life comes from my mama and my daddy, both deceased. My mother lived to be 97, about a year ago. Okay. But I got to tell you something. I learned about common sense from my grandmother. And I talk about that in the first paragraph of this article. Okay. Mother wit, common sense. If we just apply common sense to what we do, it improves us as leaders. I use what is called the 2 C's. I do a lecture called the 2 C's and the 2 E's. 2 C's stands for I understand how to collaborate. I learned to become a good communicator. The 2 E's, I've been exposed to a lot of stuff, which has given me a lot of experiences, Rebecca. I'm not an old wise guy yet. I consider myself to be still learning. Learning is lifelong. That's my philosophy. I'm still learning. But I want to share information with people. This is why this podcast is so important to me. I love Mike Maru and I love Andrea Bittman. I love you now because you're doing this with me. This is about how we share information. I expect you to do this better than me, Rebecca, when you're out there at age 73, hopefully you've been a dean or a provost or university president, okay, top-notch orthodontist, blah, 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 okay, because this is how we build the profession of healthcare. Notice I didn't say dentistry. I said the profession of healthcare. That's where we are today. It's healthcare delivery, in which we are a very important part of that. Dentists are critical to oral health and Total Health of America. When you get a chance, do Google. I hope your listeners do. Google the 2000 edition of Dr. Satcher's first ever Oral Health of America. It's going to teach you a lot about our history. We're working now on 2021. Surgeon Jerome Adams, and you get a chance to get it done. Dr. Worthy, the new Surgeon General, hopefully McWorthy will have it published this year, I hope, along with Dr. Tim Ricks, who's Deputy Surgeon General. This is so important. And it talks about, I was one of the individuals involved in reviewing this document because it's important that we talk about the interprofessional piece and how to integrate healthcare. So important.
Yeah. Well, I really look forward to reading your article in the ACD newsletter. That sounds
It's cool. It's cool. It's cool.
I'm really excited about it.
So, students today, this is a good podcast for them to really hear because it makes them think about, what do we do now? What do we do next? SPEAR is a good example. I just love SPEAR. I've always been student focused because of the legacy piece. I would never say no to you. I said, when Susan said, Rebecca Long's trying to contact me, what does she need? She wants to do a podcast with you. I said, perfect, let's get it done. As I told Mike Maru, I said, Mike, one of the things that I want to see happen is the legacy piece, the next generation of leaders in healthcare and healthcare delivery, whether you're in a private practice, whether you're a DSO dentist, whether you are a military dentist, whether you're a public health dentist, whether you just go into research, which we need researchers, okay? It is so important to follow your dream, follow your pathway, because you're going to make a difference. That's the key, Rebecca. Regardless of what you do, you're going to make a difference. I always tell people all the time, dentists make money. They're going to do fine. But I want them to make a difference in the lives of their patients, in the lives of young people who see you, Dr. Long, as a role model. How does that affect that young person as he or she grows and matures and say, wow, I was in there with Dr. Long at USC Dental School. Man, she's cool. Oh my God. That's the impact. That's an impact. And I view myself as making a difference in the lives of young people. It's not about me, Rebecca,
Talk about your accolades a little bit more, but I mean, you have been such a great leader in so many different areas of dentistry. And I mean, I can't help but believe that it's because of how much you want to share and make it about not you, about everyone else. And I mean, as far as SPIA is huge on leadership and professionalism and how we approach that. And I've always said leading by example is best, but being able to share information and, look at what I know, but let me help you with whatever I can and make it as much of a teamwork as we can. I mean, dentistry, I played sports in college, which taught me so many valuable lessons. I can't even begin to talk about leadership in athletics, but the way to lead people and to bring them, make them the best that they can be is to help them through that process. And the fact that you come on here so eagerly and willing to help us learn. And I mean, we've been on this for a little over an hour now. And I mean, I've learned a ton. I know our listeners will learn a ton. And there's no one better to teach about leadership than someone who has been a leader in so many areas of dentistry and successfully. I mean, you have not only just held these leadership positions, but changed so much and made things so much better once you've left. That's inspiring to everyone. So
I am grateful to you for sharing that with me. Pat Blanton, who is a dear friend, past ACD President, former MUSC Dean. She's a wonderful lady. I hope you meet her one day. I got to tell you, she coined the term, and I was kind of embarrassed when I got the article from the ADA editor saying, you're being mocked as the leader of leaders. I said, where'd that come from? I said, well, it's from Dr. Blanton. And Pat said that because she knows how I feel about sharing information. I don't need a halo over my head, Rebecca. I got enough bells and whistles. I got behind me my ADA Distinguished Service Award. Also behind me is my ADEA Distinguished Service Award. That's fine. But that's shared with those who helped me get to that point. And I value relationships. I value information that's shared. I build teams, Rebecca. There's no I in teams. There's no me in teams. Okay. And I learned from the military, really, the value of leading and caring for young men and women that I was responsible for. Those are values. When you talk about values of life, when you're a leader and in the military as a commander, in civilian world as a dean, as the president of the American College of Dentists, as the president of the board of the American Dental Education Association, you learn that people are looking up at you for your ability to hopefully motivate and move the organization forward. It's not about Rouse. It's about the organization. You learn in the military, it's mission. It's mission. And everyone is in the same boat. When you're going to engage in a battle as an officer, a law commissioned officer, or a civilian, you're doing that for the good of the nation. When you're in dental school at USC, working with Avishai as your dean, you're doing things to bring credit to the University of Southern California Dental School. It's not about Avishai trying to be the almighty dean because he's the good guy. I know him personally. All our deans, all of our associate deans, all of our faculty, all our program chairs, regardless of where they are in the institution, hopefully their commitment is to the young students who will replace them one day if they so desire. I commissioned when I was dean at dental school, I commissioned 32 officers, Navy, Army, and Air Force. And I told them all, I don't expect you to make a career out of this, but you're being commissioned, you're going to take an oath, you're going to defend the Constitution, represent your community, represent your unit, first at the dental school well when you go out there. And there's some folks who are still on a career pathway. I participated in a virtual commissioning last month, one of my former students. It was cool to see her, okay? And she says, I'm following your path, Dean. I said, no, you're not. You're making your own path, okay? I said, I'm just happy that I was able to help you move that path in that direction. And that's what we're talking about. It's about people, Rebecca. It's about people. If we can get the nation to understand the value of collaborating and just having a conversation, communication, listening skills are critical to my life. I listen. I want to hear. I'm not going to tell you, oh, that's dumb. No, there's nothing dumb. Back to my earlier comments about young people who may be told, I don't care whether you're black, white, people, or yellow. You may be told, oh, you're not good enough to do that. Oh, no, no, no. If your heart says, I want to be an orthodontist, that's your pathway. And you go for it. You go through the rigors of applying. You prepare your CV. You get good grades, whatever's required to meet the criteria. But you don't accept the fact you're not good enough to go into ortho. Oh, no, it doesn't work that way. I didn't get up in the morning wanting to be a dean. I didn't get up in the morning to want to be U.S. Army Dental Command Commander, 4,000 plus people. I didn't get up in the morning to do that. It was something I got, put in my lap, and said, okay, you're now the commander. Okay, you're not a dean. Okay, you're not a president of American College of Dentists. Go forward, my son, and help these 8,000 folks. Oh, by the way, you have this affiliate called SPEAR, okay? And oh, wow. I mean, I got so excited when I met Mike Maroon. He was just one of these, constantly in motion. Yeah. Love Mike. I just love Mike. Because as a leader, he understands what is needed to move an organization forward. It was a vision that he had over a decade ago to look at the ethical engagement of students in their dental education. How do we do this? How do you enjoin people? Because, look, Rebecca, when I was a commander, unfortunately, I had to put some people in jail who did some dumb things in the military. I had people who I know have gone to jail for Medicaid fraud and doing the wrong thing with patients. I got that, all right? But you know what? It's a value judgment system. You learn how to always do the right thing smart the first time. And it's not rocket science. So, I'm not holier than thou, and we've all had experiences. But what's more important to your learners and your listeners rather today? Value the fact that you are a provider of healthcare. You will be given the responsibility and the right to treat patients. I told my students all the time, part of my dean's job is to prepare you, all right, to protect John Q. Public. And I want you to understand that's critical. John Q. Public can take what you've earned away from you in a heartbeat. So ethics, professionalism, and leadership, the advancement towards excellence, those are creeds that we take, okay? When you take the oath, when you get your degree, take it seriously. Doesn't mean you can go out there and just disregard someone who has a pulpal infection or what appears to be maybe a lesion on the roof of their mouth, under the floor of their mouth, or whatever the case might be, and you disregard it because you want to get that implant done. Duh, we don't do that.
Right.
It's about ethics, value, doing the right thing for patients, because it's critical to what you may do and become. Do you want to become a great healthcare provider, or do you want to just become the average person who just wants to make a buck?
Well, like you said, dentists are going to make money. It's whether or not you want to make a difference in the world or not. I mean, why did you go into this field? To help people or to make money? Realistically,
Make that a tagline. Make that a tagline, because that's critical. Okay.
Great. Well, thanks, Dr.
Nice meeting you, ma'am. You take care of yourself. Good luck to you at school. And when you see your great dean, you just tell Abishai I said hello.
I will.
We had a great conversation. Okay.
Awesome. Well, thanks, Dr. Rouse. I appreciate it.
Thank you, Rebecca. You take care of yourself. Bye-bye now.
Bye.
Thank you. Bye.